I'm going to talk about fetal circulation in this video, and to really understand fetal circulation, first you need to know some basics about postnatal circulation. So here we have a basic diagram representing postnatal circulation. So if you imagine the way that blood flows through the body, if you've got a diagram here of the lungs and here of the body, let's say blood starts in the right hand side of the heart, in the right atrium, flows to the right ventricle, then this is pumped out into the pulmonary arteries, which takes blood to the lungs. You get rid of CO2 there and you pick up oxygen there. It then comes out of the lungs through the pulmonary vein into the left atrium, left ventricle, and then out into the aorta. And from there all that oxygenated blood is taken to the body where it's used, and the blood then picks up the byproducts of respiration such as CO2. These are then taken back via the inferior and superior vena cava back into the right hand side of the heart. So essentially the objective of postnatal circulation is to take blood from the right side of the heart to the lungs, then to the left heart, then to the body, and then to return back to the right hand side of the heart. So next we have a diagram that represents the fetal circulation. You can see it's a little bit more complicated, and that's because the objective of the fetal circulation is to take blood to the placenta instead of the lungs to get rid of those waste products and to pick up oxygen and nutrients. So let's label this diagram. Okay, so you can see some key structures here, and some things that I particularly want you to pay attention to are the ductus arteriosus, the ductus venosus, and the foramen ovale. Now these represent the three fetal shunts, and they're essential to making sure that the fetal circulation works properly. Let's go through how the blood flows through the fetal circulation. So if we start with the aorta, the blood is pumped out of the heart, so you've got oxygenated blood coming out of the heart, going to the body, down this way. But a portion of that blood, once it is split into the common iliacs and then the internal iliacs, a portion of the blood comes into the umbilical arteries. And this blood flows through the umbilical arteries into the placenta, and the placenta is where the fetal blood and the maternal blood come very close together, and nutrients from the maternal blood can transfer into the fetal blood, and all the waste products from the fetal blood can transfer into the maternal blood. So once they've been through the placenta and all that good stuff has happened, the blood flows out of the placenta through the umbilical vein. Now the umbilical vein is connected to a shunt. So this is lovely oxygenated blood coming out of the umbilical vein. Now 20 to 30% of that blood goes through a shunt called the ductus venosus, which is here. And 20 to 30% of that blood joins the inferior vena cava directly. So all that lovely oxygenated blood goes straight up the inferior vena cava into the right side of the heart. Now the 70 to 80% of the rest of the blood joins with the portal vein going into the liver, and then once it's been through the liver comes out of the hepatic vein and also joins the inferior vena cava. So you've got all that lovely oxygenated blood coming into the inferior vena cava into the right hand side of the heart. Now this is where we meet our second shunt, and this is called the foramen ovale. So what this, it's difficult to see on this diagram, but what essentially this hole does is it's a hole in the wall, the septum between the two atrium, or the two atria. So it allows blood to flow from the right atria, bypassing the lungs, bypassing the the right ventricle, straight through into the left atrium, where it can go into the left ventricle and out to the rest of the body. Okay, so the foramen ovale allows oxygenated blood to bypass the lungs. Now, not all the blood goes via the foramen ovale. Some of it goes via the right ventricle into the pulmonary artery, or the pulmonary trunk here. Now this is where we come across our third shunt, which is called the ductus arteriosus. Okay, now this is a connection between the pulmonary trunk and the pulmonary arteries and the aorta, which means that once again blood can bypass the lungs and go straight from the right ventricle into the pulmonary trunk, into the aorta, and down to the rest of the body. So here we have two ways, the ductus arteriosus and the foramen ovale, for blood to bypass the lungs in the heart, because we don't need circulation going to the lungs. The lungs aren't really doing much in the fetus. Now these shunts are aided by the fact that in the fetus the pulmonary vascular resistance is very high, and this is because the alveoli are all closed and everything in the lungs is sort of squeezed. So flow is always going to prefer the path of least resistance. So instead of going into the pulmonary arteries, it flows into the aorta. But what happens at birth is the baby takes its first breath, and this causes all the alveoli in the lungs to expand, decreasing the vascular resistance in the pulmonary vessels. There's also a drop in the circulating prostaglandins in a response to the increased oxygenation of the blood from taking that first breath. Prostaglandins are important for telling the ductus arteriosus to stay open. So when you have a drop in these circulating prostaglandins, the ductus arteriosus closes and becomes the ligamentum arteriosum. At this point the foramen ovale closes and it just becomes a sort of notch in the right atrium and the left atrium called the fossa ovalis, but there's no actual hole there, and this allows normal adult-like circulation to happen after that first breath. Finally, the ductus venosus will close automatically, because obviously at birth the umbilical cord is cut, and so there's no circulation coming through this umbilical vein. The only circulation is coming through the portal vein. So everything behind this line, sort of thing, becomes obsolete. So this will just functionally close on its own, and then eventually turns into something called the ligamentum venosum that we can still find in adults. So that's fetal circulation. Thanks for tuning into this video. If you found this helpful, then there's plenty more resources to find on the website zerotofinals.com. You can also check out the book on Amazon called The Medicine Manual. This explains all the tips and tricks that I found very useful for getting through medical school. Please like, comment and subscribe to the YouTube channel, and I'll see you again very soon.